Hey folks, Dr. Beyer of Functional Medicine Solutions, and this video's topic is about anemias. Anemia is the term we give for the situation where our body cannot carry oxygen very well for a variety of reasons, which we'll talk about. Our body, specifically the red blood cells, can't carry oxygen to the tissues like they can. There's a diminished ability for the red blood cells to carry oxygen to the tissues. And anemia is what many doctors who do functional medicine consider like a deal breaker issue, meaning there's pretty much nothing that's going to get better until you fix an anemia if you have it there. Because oxygen, every metabolic function, okay, all the tissue repair and healing, our tissues need oxygen, our cells need oxygen. So if there's a diminishment, even a 5–10% diminishment in the carrying capacity of oxygen, it's really, really difficult, or a lot of times impossible, to get a chronic condition fixed up. And so it's a deal breaker issue. The key is to find out, of course, do you have it, but what specific type do you have, because there's different types of anemias. And this is where the right blood test comes in, measuring enough markers and knowing how to evaluate those markers. And what evaluate them means is making sure you have a doctor who looks at the functional ranges, not just the lab ranges, but the optimal or functional ranges. I have a video that talks about that, and measuring enough markers. So I'm going to give you the anemias is really kind of a complicated topic, a really in-depth topic. I'm going to keep it simple and narrow it down to like 4 types of anemias. One type of anemia is where the red blood cells, for one reason or another, usually it's a genetic condition, they're being destroyed. It's called a hemolytic anemia. Now I'm starting with that because that's the least common, okay? And most people at an early age in life discover whether or not they have that type of anemia. There's conditions called like beta thalassemia or sickle cell anemia, or it's not necessarily a hemolytic anemia, but the cells are abnormally shaped and can't carry oxygen like they should. So there's these kind of less common causes of anemia, genetic conditions, and or hemolytic issues where the red blood cells are being destroyed. You can determine that with the right blood test. If you're working with a doctor who knows how to work through that, we can see abnormalities on the initial blood test, and then if we suspect there being genetic issues like sickle cell or beta thalassemia, there's specific tests to pinpoint that. But that's not very common. Most people at a fairly early age in life know they're having that. Or if there's a hemolytic condition, that can be picked up on the blood test also by detecting elevated levels of things called bilirubin. More commonly, what we see in functional medicine is an anemia due to one of 3 things. It can be what we call a macrocytic anemia, which means that the red blood cells are bigger than they should be, and that's due to a deficiency of certain B vitamins, particularly B12. The red blood cells begin their life within the bone marrow, and when they're early developing in the bone marrow, they're very big, and they gradually become smaller before they're released from the bone marrow into the bloodstream. And that process of going from big to small needs to happen if they're going to be able to carry oxygen well, but it can't happen if we're deficient in B12. So on a blood test called a CBC, a complete blood count with the differential, we can look at the different markers of not only just the overall numbers of red blood cells, but what the size of them are. And with the macrocytic anemia, we would see the mean corpuscular volume, the MCV is what it's called, abnormally large, indicating a B12 deficiency. There's some other markers on the blood test that can indicate some B vitamin deficiencies like homocysteine, which I talk about in a different video. But it's important to pinpoint what is causing the anemia because you want to correct it. And there's another type of anemia which is due to iron deficiency, and most people have heard of that before, but that would give a different pattern of abnormality on the blood test. We would actually see the red blood cells microcytic, or actually too small, and what we call hypochromic, which means there's not enough hemoglobin concentration. So the cells are smaller than they should be, and not as there's not as much hemoglobin concentration within the cells also. So it's a microcytic hypochromic is what they call it. And it's important to have your doctor, when they're doing blood tests, do a thorough iron panel. Some doctors will only check serum iron, which is the iron within the bloodstream, but sometimes that can be a little bit fickle. You should always make sure you get your ferritin levels checked and your TIBC, which is your total iron binding capacity, TIBC. A good iron panel will include not just the serum iron, but the ferritin and the TIBC also, because it's between the three of those that we can determine for sure is there an iron deficiency. It's not enough just to see the microcytic hypochromic red blood cells. We want to confirm that with abnormal iron stores on a blood test. And then sometimes people have what's called an anemia of chronic disease, where the overall red blood cell amount is off and some other markers indicate anemia, but it's not due to B12 deficiency or an iron deficiency. It's just an anemia of chronic disease. And sometimes there's kind of a mix between a B12 deficiency anemia and an anemia of chronic disease, or an iron deficiency and anemia of chronic disease. And that's important because ongoing chronic health issues can, for a variety of reasons, cause the oxygen carrying capacity of the red blood cells to be diminished too. And we wouldn't want to only treat the vitamin or mineral deficiency, the B12 or the iron deficiency, if there's a mixed anemia. So anemias are deal breakers. You need to get them fixed if they're there, because no chronic health condition will really improve as you want it to if it's still present. And so it's super important to determine not only do you have an anemia, but what's causing it. Okay, is it something dangerous, something medical, a genetic issue, which you should be aware of, or a hemolytic issue, or is it a B12 deficiency? Is it an iron deficiency, or is it kind of a mix between a chronic and a vitamin or mineral deficiency? So I hope that helps. More information on our website. If you're not on my website already, it's functionalmedicinesolutions.net. And I offer to people to pick my brain. We call it the free Ask Dr. Beyer session, where we can have a 15-minute no charge phone or video cam consultation just to get a few specific questions asked. So hope that helps.